That's why you need something a little more permanent. If you've been holding off on veneers because you don't want to file down your real teeth and wait on your results, or maybe it's too expensive, well, guess what? That process is much easier today, and in most cases, no filing is necessary. Dr. Terry Alani, the Texas Tooth Lady, is here with the latest on veneers. Good morning. Good morning. All right, so just like technology has changed in so many other things, technology has changed in the way these veneers are put on and what they're made of.
Okay, so basically what we're going to talk about today is Lumineers, but I want to correct you on one thing. So there is minimal prepping.
Okay, minimal prepping, but filing them all the way down like they used to.
No, we don't do that anymore. It's the most requested veneer system there is. And the Lumineers. So basically, I'm going to show you guys how we actually prepare the teeth very minimally because nobody wants their teeth drilled down.
Right.
Lumineers are very, they're contact lens thin and they're very strong, very durable.
All right, so the other question people oftentimes have is how many do we need? And let's take a look at a video here that gives you a kind of example of why you don't always need a set number.
Yes.
Okay. And we're just going to pretend that we've done a veneer here and that we're going to add a little bit of material onto the tooth to make it look a little longer. Bite down and slide to the right, slow. Slide all the way. Keep going, keep going, keep going, keep going. Stop. So by building this tooth, this is called cuspid rise. It allows space here so we have room to lengthen. That's why you are going to need to have these teeth included, and we don't want to stop here because that's all you see. We want to go back to your bicuspids, okay?
So basically covering everything when you have your full smile.
Right, so it's really important. A lot of patients come in and go, how many veneers do I need? If some patients come in and the front teeth are chipped, the reason their front teeth are chipped is because those eye teeth have been worn down. So they go into these excursions, they're actually hitting their front teeth, causing that chip to keep reoccurring. Okay. And so it's really important. A lot of times we'll either do 2, 4, 8, we rarely do 6 because we want to build out the buccal corridor.
Yeah. And then the process is basically, it's different for everybody, right?
Yes, the process is very simple. We take impressions, we send them to the lab, and I think we have a video showing exactly. So this is the patient's teeth before. We send that to the lab, we take study models, and then they will do a wax up. That is a wax up of what their veneers will look like. We have temporaries that we make so the patient wears a trial smile and they can determine exactly what we need to do to adjust it if they like it or not.
Yeah.
This shows you exactly where we prepare. So I call it Lumineer by number. You can see it's colored for us so we know exactly where we need to reduce the tooth structure so we get the best results.
Yeah, and speaking of the reduce, like I said earlier, you don't have to drill it all the way down like you used to.
No, absolutely
but there is,
not.
Yeah, you mentioned minimal prep just to get it to all fit and be consistent with each other.
Exactly. So we get templates, and the templates actually fit over the teeth. And this will show you exactly where we have to drill. So where there is a, you can see on the edges, the tooth is sort of hanging past. That's all that we reduce with this template. Then we put another one in, and this shows us where we adjust on the outside surface of the tooth, and that's it. And then you'll see exactly what the prepared teeth look like, which is very minimal. This was done without anesthesia. There was just, and that's the preparation right there.
Yeah, everybody's like, oh my God, you're just done without anesthesia because you don't need it, right?
No, you don't need it.
All right, and then you do like a trial smile so people can get an idea of what it's going to look like, obviously, before
That is the most important part, the trial smile, so the patient can actually wear their temporaries and say, listen, I want this tooth a little bit longer, and so they know exactly what their teeth are going to look like when we get the final results.
Yeah, that's where you get all excited. In fact, that's where one of your patients got really excited. Let's take a look.
I love it. Oh my God, they look so good.
So this is a picture of her before, and then the right is just her temporaries. That is not the final product. Those are just her temporaries.
But you get a chance to live in it for a second.
You get a chance to live in it. We call it the trial smile, and it's just so beneficial for the patients.
The other thing about this is, like, you know, oftentimes people come in and go, I want super white teeth. I just want white, 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 white. You match it to your skin color, your what looks natural for you.
We do, but I will tell you,
white is right,
everybody wants white
right,
teeth. So we have these shade guide. This is what the shade guide used to be.
Oh,
the lightest shade on the lightest tooth is the one, there's a tab in the middle. That was it. We couldn't go lighter.
Oh,
but
no,
then
yeah.
people started whitening their teeth, and now these are the shades we go with.
But you got 4 to choose from.
Yeah,
there.
the one on the left is the whitest. Most people go right in the middle.
Yeah,
And
yeah.
if you notice that a lot of people, when they get their upper teeth done, they may not do their lower. We whiten their lower, but they usually don't quite match, and it's okay. If you look on the news anchors, a lot of them, their upper teeth have been done and their lower's not. But
You can look at
it's
news anchors
okay.
or talk show hosts.
Yes, and talk show host. Yeah.
No, let's look at wait, here, I'm gonna fix it right now. Let me get here. All right, there we go. I'm good now. All right. Okay, then the bonding process. And this is kind of one of the things, too, that makes it an easier thing to do in terms of the process.
So veneers are basically bonded the same way. And this is a tooth. We place it over the preparation, right? And this little suction tip that actually allows us to place them easier. We do it one by one. We place them all on. That's what they look like. They're thin. And then we go in, and that's our final result. And we'll go in and we take off all the excess cement.
Wow. Okay,
So,
how long does that last?
The veneers can last up to 20 years. Wow. Yeah. And we recommend patients wearing night guards. Very important. And here is her before, her trial smile, and then her after.
Yeah, and there you go. It's just all much more even.